The FDA wants Facebook, Google, and Twitter to crack down on opioid sales on their sites. So is it time to step up security on social media? Here now to weigh in is forensic psychiatrist and addiction specialist, Dr. Daniel Bober. Thank you so much for joining us this morning. We really appreciate it.
Thank you for having me.
So this is crazy. I mean, parents hearing this right now are definitely going to be concerned. Facebook, Twitter, Google, a black market for selling opioids?
Absolutely. You know, the dark web has been a place where people have bought drugs like fentanyl and carfentanil, drugs that are 100 and 1,000 times more powerful than morphine, and have killed over 100 people a day. So parents really need to be on top of their kids and start keeping these computers in a common area and having access to their smartphones to know who and what they're doing.
Yeah, I was reading that 98% of online pharmacies are illegal because mainstream drug providers, they're restricted from actually advertising drugs, anything in that capacity. This is Facebook's response. We want to take a look at this. They say, we care deeply about opioid addiction in our communities, and we're committed to doing our part to implement solutions. We've taken numerous measures to minimize the opportunity for these activities to take place on our platform. So my question for you is really, what do parents need to do?
Well, like I said, I mean, parents need to be on top of their kids in a way they never were before. I mean, they could be in their rooms with the door closed. I mean, the internet is like a dirt road without a sheriff, and now the parents really need to take the role of being the sheriff and keep those computers in the living room in a common area and have access to their kids' smartphones. You know, a lot of people say to me, well, what about trust? What about privacy? And I say, you know, safety trumps privacy. And, you know, an old president used to say, trust but verify. So the parents really need to be on top of what their kids are doing.
Yeah, absolutely. Let's move on to this next topic now. Smoking with children under the age of 6 in your car, it could soon be illegal in Columbus, Ohio. So shouldn't more cities do the same thing? And does this not apply to kids regardless of whether they're under 6? I mean, 7-year-olds, 8-year-olds, 9-year-olds?
Well, you know, it's interesting. You would think that this is something that would have happened a long time ago. We know that secondhand smoke in children increases the risk of respiratory infections, middle ear infections, asthma, increases the risk of SIDS in infants. So, you know, this is really a public health issue, and smoking around your children is child abuse, pure and simple.
Yeah, we're taking a look right now. There are some states that have smoking laws for underage kids. You can see there, I mean, they range from 18 years old down to 8 years old, I think is the youngest so far. In terms of, I know you were just speaking to this, but what can happen inside a car for all of us if someone is smoking?
There is no safe level of secondhand smoke. Even with the window down in the car when the car is moving, no parent should ever be smoking around their child for not only physical reasons, but psychological reasons, because kids are modeling the behavior of their parents, and they should not be sending the message to them that smoking is okay.
But then there's the opposite argument, more regulation. So I'm kind of torn between that because, you know, less government regulation being involved in our personal lives, I think is always important. But at the same time, people don't always make the best choice.
Well, that's true. And I think that, you know, this is an issue for me that's not about politics or overregulation. It's more about public health. And that's why I think it's, you know, something that's in the right place for sure.
Nicely said. Dr. Bober, thank you so much for joining us. Appreciate it.